Hello everybody. If you're thinking about having a joint replacement, I want to show you something that could make a real difference to your recovery. It's your body composition. I did a video about this body composition last year, so this is a bit of an update to tell you what I've found now that I have some data. I've been using a set of body composition scales in my clinic. Keep watching and I'll tell you all about it. The results might shock you. You've probably heard of BMI, your body mass index. It's a useful measure of how fat or thin you are relative to your height. But BMI is just height and weight. It doesn't really tell us about what your body is made of. When it comes to surgery, that difference matters a lot. I've been using body composition data from the people that I see in my clinics. The special scales are medical grade so that they are accurate and very reliable. You stand on the scales and a small electrical current is passed through your feet. The scales analyse and interpret the current and produce a list of data about your BMI, bone and muscle mass. I'll put a link to my website where you can see a list of all the data that's collected. I've looked at data from people just like you, living with arthritis and who are thinking about having surgery. Here's what we found. Women had much higher body fat percentages than men, even with the same BMI. Muscle mass declined sharply with age, especially in women over 60. And women aged 60 to 64 had the highest visceral fat and the lowest health scores. Visceral fat is the fat deep inside your abdomen. It's normal to have some visceral fat, but if you have too much of it, it's a problem. It increases the risk of diabetes and metabolic syndrome. This is associated with things like high blood pressure and heart disease. It drives inflammation, delays recovery, and increases the risk of complications after surgery. It means that your recovery after surgery isn't just about your age, it's also about your internal health and general condition, particularly muscle mass and strength. But if you aren't in great shape, don't despair. You can do something about it. Here are 3 things you can start doing today. Build or maintain muscle. Even light resistance exercises can help. Think about seeing a physiotherapist who can help you with exercises that can make you stronger without aggravating your symptoms. Eat more protein. Most of us don't get enough of it. You need it to maintain muscle and recover after surgery. Eggs, lean meat like chicken and fish are all high in protein, and they'll help you to build up reserves before surgery. Reduce your visceral fat. This isn't about crash dieting. It's about improving your metabolic health with the right food, activity and habits. I've said it before and I'll say it again. Cut out the carbs like bread, biscuits and cake. Stop drinking alcohol. I know it's hard, but honestly, you'll feel the benefits straight away. Remember, it's not just what you weigh, it's what you're made of. Better body composition, more muscle, less visceral fat, can help you to recover more quickly and get you back doing the things that you love after your surgery. Even if you're not going to have a hip replacement, getting yourself into better shape will improve your health and make you feel better. I hope you enjoyed this video. If you've got any questions or comments, please leave them below. If you'd like to get in touch, the details are in the description. Thanks for watching and I'll see you all again soon.